So Gary, on that, just, all of us have, through lockdown or shelter in place, have been forced to work from home. As a question about people overcoming mental health issues that arise from working at home or isolation when you don't really have a personality that is suitable to that. I'm a professional networker, dot connector, so I mean it's been very different to be on lockdown for 55 days and in 50 Zoom meetings a week.
Oh yeah, absolutely. I mean, my wife and I have worked from home for 15 years, but we're on the road all the time. And as I mentioned, I think I did 150 talks in the past 2 years. And so I really miss, I deeply miss that in-person human connection. So first off, we've been through a period where the rules were, essentially to narrow our human experience down to our four walls. Hopefully, assuming we have four walls to narrow it down to, and and obviously in the U.S. with our challenges with homelessness, not everybody has those opportunities. But by narrowing down that human experience, what ends up happening is we lose a lot. We often don't know what we're losing. That is psychologically, I think the data is very clear. We have a set of reactions, processes we go through. And especially in the first phase of the Great Reset, we're just in react mode. So now, as we start to think about what we need as we revive, as we start to rebuild our institutions, rebuild our organizations, rebuild our economies and our communities, I believe what's going to end up happening is, so let's say that your work is highly digital. And remember, there's a really big distribution of the kinds of problems people solve. And a whole bunch of people need to be on site. They can't, you can't serve a meal remotely unless you're, just taking orders on the phone and they're delivered by Uber Eats. So there's a lot of work that is not actually digitizable. But let's assume that your work is, but that doesn't, it's created a bunch of challenges for you as an individual. What I believe is we need to do is we need to be intentional constantly about the yin and yang of each of us as individual humans and our, the important issues for our lives and each of us as workers and how we actually meld those together and the way that leaders and managers all have the balance of competence and compassion of both helping people to do their best work, but also ensuring that they're helping people to actually live good lives and to be able to deal with a lot of these challenges. So let me just give you some examples of what I think is going to happen. First off, you're going to see probably more node-based work. That is, it isn't binary. It's not either you're at home or you're in the office. Is there going to be more nodes? So for instance, when there's a distributed organization, but you can have 6 to 20 people that could be co-working or gathering together on a regular basis in your community, I think you're going to see a lot more of that. You're going to see the potential for more co-working, but where people are actually, there's more collaborative processes for doing that. You're going to see people that hopefully will also have access to the resources of coaches, of people that can help them to be able to track on their mental health, people to track on their physical health, made available through these kinds of things like Zoom calls. But you're going to have a community you actually can still go out and engage with, right? So even though your workers, your collaborators are remote, you still have a community you can go and deal with. And actually, there's no reason why you shouldn't have some software that could help you to remind you, hey, you need to get up and go do some exercise. You need to get out. You need to be interacting with other people. You've got essentially a range of different ways that you have help to be able to directly and intentionally deal with those mental health issues. Now, by saying that, I don't want to diminish any of this. This is a really, really challenging time. If we're not going to leave any human behind, we need processes as leaders and in organizations to know when people are actually falling below the baseline. We've got to have far more intention about seeking out workers to ensure that they're able to actually go through this transition. And we're designing work collaboratively with them that actually adapts to what their best work style is, their own personal circumstances, and so on. But I believe we can hit that balance more frequently if we're also just all recognizing we now see literally into each other's lives. We can bake that into our processes as organizations to be much more humane about how we structure work.